Aloha and welcome back to Living 808. Now, if you're in the other room, I want you to come in and hear this. Sandra's story about how aquatic therapy has helped live her life dealing with fibromyalgia. Check it out.
Well, I actually have post-traumatic fibromyalgia, and it happens from a trauma, and then the fibromyalgia set in because of the trauma. And it is widespread pain and nerve. 16 years ago when I got injured, for 2 years I went through numerous doctors, other physical therapies, land physical therapies, chiropractors, massages, medication, and it all didn't work. None of it worked. And someone suggested that I go into the pool. My biggest problem with my fibromyalgia is that it's very difficult for me to bear any weight. And the pool, of course, takes away that. And so I went to La Pietra 14 years ago, and Julie was my physical therapist. And I want to tell you, when I first got into that pool, and of course I was very negative at that time, very skeptical about a lot of things. When I walked in, it was like, wow. So Julie was my therapist for a few years, and then she went on to different things. And then the pool at La Pietra closed. And someone saw an ad on the TV, and we got connected again, and I've been with her for 7 years. It has been really terrific. She listens to what your problem is, and for a lot of things, it's difficult for me to do. So if she tells me, oh, okay, I want you to do 10 of these, and I'm like, oh no, I can't. Okay, went into 5. And that's what I really, really love about her. And the pool is just wonderful. It's heated, because the cold bothers the fibro, the nerves, and it's just really a good thing. I do a little walking, I do some aqua jogging, and then just recently I attended a class that she was offering for I Chi, which is Tai Chi, but in the water. And I'm really enjoying that. For me, it's part of my life. It's something that there is no not coming, no quitting, because without it, I would not be able to move around like I do now. There is no quitting. It's just something that's got to be done. I worked my way up to do some land, which I never thought I'd be able to do in a million years. But I can do some land things. I never thought I would be able to do it. I've had it for 16 years. I was in my 40s, and I thought, wow, what happens when I get into my 60s if I'm feeling like this? I am in my 60s now, and you know what? I'm living, and it's I'm not saying it's just also wonderful, but life is good, and you got to keep moving.
Wow, I'm joined now by Julie Moon of Moon Physical Therapy. An amazing story, isn't it?
Really inspirational.
It is. No, and actually, I've gotten a chance to get into that aqua therapy pool, and I went backwards. And as you can see, Sandra was just going along. She's amazing. Now, first of all, talk about fibromyalgia. It's such I still kind of have a hard time understanding. It's such a difficult, hard to analyze, and hard to diagnose condition, isn't it?
Yep, it's a complex condition. 80 to 90% of those people that have it are females. And it's hard to diagnose because there's not one symptom. It's actually a combination of different symptoms. So patients could have generalized and widespread pain. They could have tenderness all over, headaches, mental and physical fatigue.
So many things. Wow.
There's so many things. And what's really deceiving about this type of condition is, on the outside, they look healthy.
Yeah, yeah.
But on the inside, it's where they're suffering. And a lot of times, they can't even walk to the mailbox to get their mail.
That's what Sandra was saying. It was just impossible for even her to get up in the morning and get out of bed. And she said, what was wrong? What was wrong? And it's so important that she was talking about the physical therapy because, correct me if I'm wrong, there is no cure for the condition, right?
There's no known cure. They seem to think it has to do with the way the nervous system processes pain. And it can be due to surgery or trauma or a major emotional stress. But because there's no cure, what we have to do is try to help them manage their symptoms. And research studies have shown that moderate regular exercise actually helps improve their symptoms. It lessens pain, it reduces their depression levels, and improves their overall function. And a lot of these patients, they say physical activity increases their pain, so a lot of times they're reluctant to exercise.
Yeah.
But if they work with a physical therapist that is familiar with fibromyalgia, the therapist will actually help them, teach them how to start slow, how to pace themselves, how to set realistic goals, and they're there if they want to modify the program, just in case if they're having a bad day. With fibromyalgia patients, it's really important because there's a fine line between exercising just enough so that they can get the benefit, and then exercising too much where they'll have flare-ups, and the flare-ups could last for days.
Well, and I think that's why she was saying it was so important that you're so great at listening. I mean, you have to really listen to what she's saying, and maybe this day is good and this day is bad.
Yep.
But also, too, is that why what you guys offer at the Aquatic Therapy, she was saying you get into the pool, it takes the weight off, so it really helps starting that process of therapy, right?
Yeah, a lot of patients with fibromyalgia, they respond really well to warm water exercise. They're intolerant to cold. They have difficulty exercising on land. So because relaxation for them is really important to controlling the fibromyalgia pain, being in the warm water, it actually helps them. It provides a sensory stimulation to the whole body, so it helps them relax and it reduces their stress levels.
That's amazing.
So the whole time that they're in there, they're able to improve range of motion, increase their strength and endurance, all the while without exacerbating their pain.
That's amazing.
Yeah.
That's amazing. And we see with Sandra Strait, now she's doing more weight-bearing exercises. She's doing more stuff on land because of what she started at the Aquatic Therapy
Yeah,
side.
so she started with me in 2008. And she's come such a long way that she's right now in our maintenance program. So she exercises 1 day in the water, and she's progressed to a land-based program. She's become such an inspiration to me and some of my other fibromyalgia patients. I've actually introduced her to some of our newer patients that need the encouragement and motivation.
Yeah, I know, and it's I got to ask you, you've worked with her for so long. Is it make you feel good inside to see her, I mean, just come out? I was talking to her, and I was like, you're doing better in the pool than I was. I was amazed. How does that make you feel inside to see, her enjoying and living life to the fullest now?
It's so rewarding. It's so rewarding. And, over the years, we've just developed a relationship where, it's not just patient-therapist. We're actually friends. And so she's been a real inspiration to me and to everybody else that's there.
Julie, thank you so much. And again, when it
you.
comes to great therapy like this, if you know someone that needs help, again, having a physical therapist that listens and can actually help you out all the way through, that's why Julie Moon is the best at Moon Physical Therapy.